Hello, everyone. Welcome back to our weekly Sunday meeting. This is our 112th consecutive meeting. And, we have been talking about deviating from COVID. And finally, today, we are not talking much about COVID, although if there is an update, we would sort of sharing that. So we have with us Dr. Nidhi Dhawan, who is the secretary of the IMA and DB, and the Associate Medical Director of the ENT and Head of Safety Committee in Shroff Charity Eye Hospital in Daryaganj. She'll be talking about a topic that, yet another very pertinent topic, being the good doctor, and, all these incidents that have happened lately have probably provoked her to take up this very important topic. So I think a topic that concerns each and every department in a hospital and every single physician that lies there. So without much ado, I would hand it over to Dr. Nidhi to carry forward the session.
Thank you so much, Dr. Vinakshi. My inspiration comes from हमारे सबके mentor, Dr. Agarwal. Being the good doctor meant that you should know what you're doing. And communication should be very clear as to what you expect from your patient and what the patient should expect from you. But I have here gone a step further to sort of say that we need to look at our own lives in hindsight now for the last 2 years, 2.5 years, whatever we've done, and create that framework for ourselves, which allows us to rise even beyond this being good and get into greatness at our own individual levels. I think it is time to revive the institution of the family physician. I think it is time to improve the connection between people and, have that uncle and auntie who knew your mom, dad, grandfather, and not just treat people when they're sick, and really look after them through their days and be friends with them. So that's where I think I get my epiphany for this. So the good doctor, we need to be prepared as care providers, and we need to start caring for human beings rather than, treat particular diseases. We will go through a very brief update of what has happened in COVID, but kind of lead it on to what seems to be the pressing problem today and take it from there. So we are still hugging the baseline. It's sort of sometimes less, sometimes more than the 7-day average, but it still hasn't taken off like Delta did or like Omicron did. It doesn't even seem to be following the path the original strain ancestral did. So again, as usual, probably we need to follow, and probably this is because, as we were just discussing, people are not testing or reporting enough, but we don't report a lot of viral illnesses. This report being the primary thing to do was because the virus was novel, because it was causing a lot of morbidity, mortality, because there was a lot to learn, do, and implement for this, which now largely is becoming like an illness which resolves with the usual methods, is not requiring special effort, and is not requiring hospitalization or ICU admissions. So even if we're not counting enough, we're not losing enough, and that's where we stand. UK, on the other hand, is showing a rise both in diagnosis as well as in perhaps hospitalizations also. Uh, but if you look at this particular 15th of July, you've got only 1,300 new cases, whereas the 7-day average they had was 27,000, which is very encouraging. But this dot here doesn't seem to be flattening. It seems to still be showing a gradual rise. UK, interestingly, has had a very sawtooth pattern where, it goes up, sometimes more, sometimes less, comes down. They just seem to have hit the baseline somewhere here, and that's about it. Uske baad, the area under the graph is being enough for them to be concerned. There might be a reason for that, and we'll come to that as we go along. Similarly, for the US numbers are huge. We got a lot of flack from New York Times and Washington Post during our Delta wave, but we are being good. So inka numbers are high, inka hospitalizations are going up, and inka seriousness of hospitalizations is also significantly high enough for them to be concerned. Now, remember that the demography of countries is a little different. US and UK have an aging population and have a largely unhealthy population, and we'll get to that. India has a very young population. We do have our red flags, but largely our population has significantly lower comorbidities than the US and the UK. Israel, finally, you see the growth seems to be showing a downtrend. For their population, they call these numbers high, but finally, even these numbers, they are going down. You can see the downtrend on the graph. What is interesting is Israel is the smallest country here and has seen the maximum number of cases per million. And that has been consistently their position. They have been number one on everything. That is despite their fitness levels. They have conscription, which allows every young person to be trained and physically fit in military parameters. So their bodies are like machines. They are, they have universal coverage of the vaccine. So they are protected, not just one, but they have even given 5th dose. So despite that, Israel has been having large numbers. US at the Omicron peak was about 2,000. UK was about 1,500, 1,400. India was about 220, and South Africa was about 51 cases per million. This week, Israel is still on top. UK is rising up to nearly 500. US with around 400. India is at 12. And अगर आप बाहर निकलोगे तो आप देखोगे मास्क नहीं है. People are carrying on with their lives. And कुछ स्पेशल सिचुएशंस में हाँ अगर आप हॉस्पिटल जा रहे हैं तो मास्क पहन लीजिए. अगर आप किसी पर्टिकुलर शॉप में घुसे हैं और बाहर लिखा है कि कृपया मास्क पहने तो पहन लीजिए. But largely, the public transport is running full strength. The businesses are running full strength. The economy is under no limitation or boundary, and people are carrying on with their own lives. And with that, we have these numbers, even if they are rising. And that is something to keep uppermost in your mind when you go forward. So again, we know, the the vaccination rates in Africa have been worse than the world, and the vaccination rates in some of these countries have been really very high. India is somewhere in the middle. Look at this map. This map is the map of the world, which shows the vaccination. Darker the color, more the vaccination coverage. Look at this map. Daily new confirmed cases per million. Darker the color, more the number of new confirmed cases. You can see a pattern here, a pattern that we have been emphasizing from the start. Look at this map now. Do you see the pattern? This is the share of adults who are obese. There is a recent report from the CDC, I think, which says that only 6.8% of US adults have good metabolic health, which is a very damning statement, which may be the reason why. And so even UK has very high rates of, look at this. This is in this 30 to 40% bracket. Look at US, it is in the 40 to 50% bracket. This is the share of adults who are obese. It does not include the overweight or metabolically sick, which would be, say, similar numbers. So you can double the number of people. If you are looking at a 30% or 35%, then you can easily make it about 55 to 60% of metabolically unhealthy people. If you're looking at a 5 to 10%, you can easily make it 20 to 25% of metabolically unhealthy people. If you're looking at a 50%, then you're looking at a nearly 100% metabolically unhealthy population. And that may be the connecting link of where the COVID is resurging in waves. Sir William Osler said, the good physician treats the disease. The great physician treats the patient who has the disease. So in other words, a good doctor is one who knows what to do, but a great doctor is one who knows who he is doing it for, and he prepares his patients for the coming future. The time now is to reinforce the culture of the family physician, the uncle who knew your father, your grandfather, the auntie who knew your entire family. These people know what happens to you seasonally, what brings you down, what takes you up, and you interact with them in the days of health and in the days of sickness. You call them to your weddings and birthdays, and you kind of interact with them as human beings. This is a graph from the Times of India, which is giving us the figures for projected prevalence of obesity in India by 2030. Now, for men, it is saying about 4.4%. And for women, it is again talking about 4.4%, which means that we are looking at a population of about roughly 5 to 6%, which is obese. And as I said, कि आप इसके ऊपर easily इसको double कर दो for unhealthy, metabolically unhealthy population. They are projecting that by 2030, 1 in 5 women and 1 in 7 men are predicted to be living with obesity. This is, it's global figures are rising. So it's in a global pandemic. It doesn't matter what is your geography. It doesn't matter what is your economy. It doesn't matter. So you have Egypt here. You have Saudi Arabia and Kuwait here. You have Palestine here. These are the places which Egypt is a part of Africa, Saudi Arabia, Middle East, Bahrain. These are affluent countries. And affluence is bringing with it increased not only adult obesity, but also childhood obesity. And alongside that, there is this strange emergence of a liberal leaning woke culture. I'm sorry, that doesn't want to call it out because our body shaming kar rahe ho. As doctors, we can't fall into that trap. I mean, we have to call what is unhealthy, unhealthy. We have to set into motion things for health so that, and it's not a judgment or a body shaming that we do when we call it out. We educate our friends, patients, people, families to better health. We allow them to understand that, this has its own risks. And look at this number. 0 number of countries succeeding in decreasing obesity in the last 33 years. 1 generation of utter, complete, absolute failure and damnation. %37% of the world's adult population is overweight or obese, but 62% of them are living in developing countries. But I feel like this red is something that a badge of shame all of us have to change. We have to bring this to a sizable, measurable number. And women are suffering more for whatever reasons. They are the homemakers, they don't have time for themselves, they don't. So we must understand that obesity in anyone, it's not gender neutral, but anyone, especially women, it seems to carry increasing health risks. What is the spending on health where obesity is high? Look at US, 14%, and look at India, 6%. This is the expenditure per capita. So they are spending about $650 and we are spending about $16 on obesity and related diseases annually. In as far as this comparison is concerned, we can gloat and wallow in glory, but we are also in that zero, which has not managed to bring down obesity in the last 33 years. In fact, our population is also showing increasing levels of poor metabolic health. Percentage of overweight by BMI. आप सब-Saharan Africa में देखो, 1980 में क्या था? Around 10, 11, 12%. 2008 में it had nearly doubled. North Africa and Middle East में it has become approaching 60%. It was around 30, 32%. Again, nearly doubled. Latin America, look at this 30%, and this is nearly 60%, 57, 58, nearly doubled. East Asia, these are the poor countries. The level was around 15% and it has gone to nearly 25%. So these people have a problem of scarcity. इनके पास खाने को नहीं है, लेकिन इधर भी obesity बढ़ रही है. Look at South Asia and Southeast Asia. South Asia, so very little growth. Probably we are here. Southeast Asia, where you have those island nations like Singapore, Maldives, all that, Indonesia, Laos, Vietnam. Again, look at this growth. These are also, Southeast Asia is also not very rich countries. Europe की तो baseline ही इतनी बड़ी है कि वो क्या उसको double करेंगे. In 1980, they were nearly 45% and now they are nearly 60%. Look at US. I mean, what have they done to their population in the last 30 years, last generation? The 42% has reached 70%. We are talking about obesity. So not only is it poor quality of daily life, but it is also a high risk for several cancers. And now we have seen also much higher risk for COVID. Interestingly, people who are obese and who get COVID, people who have other metabolic problems and who get COVID, इनके लिए nearly 150 autoantibodies have been documented. 150 autoantibodies. हम लोग बहुत सारी चीजों में कहते हैं, but this is preventable, we can do that. So preventable deafness, preventable blindness, prevention and control of malaria, prevention and control of tuberculosis. Obesity has to become the focus for all of us, irrespective of our specialities. If you see somebody who is overweight or obese, this is a sitting duck for problems in the coming days. And we've done this before, what are the criteria? लेकिन आपको वो criteria नहीं चाहिए. I mean, anybody can say who is fat and who's thin. Anybody can say who's lean and who's not. लेकिन there is a good fat and a bad fat. There is a good thin and a bad thin also. So it's not just that we are talking about the looks. We are actually talking about metabolic indicators of health. We have, over the last few decades, documented that arthritis, cancer, infertility, heart disease, back pain, diabetes, and stroke are higher in people, significantly higher in people who are obese. I don't think we have to go through a very involved calculation. I think if we just take central obesity, if we just take the waist to hip ratio, we should be able to, and वो उसका एक visual भी हमारे पास होता है कि कौन मोटा है कौन नहीं है. I'm sorry, it looks like we are, calling out names. लेकिन the right thing to do is to educate people not to feel attacked, but to take action for their own health. So, natural history of obesity is a progression to type 2 diabetes, and people with obesity have more microvascular complications of diabetes. जब मैं अपना final year कर रही थी, and that's well, not so long ago, I should not say that, but long enough ago, तब हम कहते थे कि diabetes की complications are irrespective of the sugar control you make. So in 25-30 years, you're going to see some kidney problems, you're going to see some retina problems. These problems are related to the duration of disease and not to the control of blood sugar. The parameter there seems to be obesity and metabolic health. So अगर आपकी फैमिली हिस्ट्री है डायबिटीज की, अगर आपकी इन्वायरमेंट में ऑक्सीडेटिव स्ट्रेस, साइकोलॉजिकल स्ट्रेस, सिंपैथेटिक ओवर एक्टिविटी है, अगर आपका न्यूट्रिशन पुअर है, अगर आपकी लार्जली सेडेंटरी लाइफ है, तो आप पहले ओवरवेट से ओबीस में आएंगे. ओबेसिटी में इंसुलिन रेजिस्टेंस पहले ही शुरू हो जाती है, जिसको आप नोट भी नहीं करते हैं. एंड as the insulin resistance sets in and the metabolic syndrome tightens its noose, फिर आपको sugar levels दिखने शुरू होते हैं. There is impaired glucose tolerance with clinical onset of diabetes. तो आपके पास ये लंबी विंडो है जिसमें आप डायबिटीज को प्रिवेंट कर सकते हैं, जिसमें आप मेटाबॉलिक हेल्थ को रिपेयर कर सकते हैं. After this, there is ongoing hyperglycemia with microvascular complications like retinopathy, nephropathy, neuropathy. With ongoing hyperglycemia, there is atherosclerosis and there is hypertension, and ultimately there is disability. But there is a large window of prevention open to us. Why is it important to look at this? So our world in data mein, if we look at the graphs, US का graph देखिए कहाँ से कहाँ पहुँच गया है. This is 1975 and this is 2016. More than 35% of population, nearly 40% of population has body mass index equal to or greater than 30. I'm saying this is simply obesity. We are not including overweight in this. Don't be misled by the low figure, which is not low in any case. Look at Israel, 26%. Look at UK, 30%. Look at India, it is 3%. I'm not for a minute saying that we should be proud of the fact that we are at the bottom of this chart. But what I'm saying is that COVID इन्हीं 3 countries में तो havoc कर रहा है. Is that the reason? I mean, there would be many reasons. It would be simplistic to say कि यही cause है. लेकिन poor metabolic health could be one cause of why things are not getting controlled in some geographies. Despite high vaccination, despite good medical facilities, it might be population demographics. Metabolic syndrome is on the rise globally. Overweight population share is much bigger than the just obese. There is significant morbidity and mortality with COVID and metabolic syndrome. It is time to put people first. Whether it is a simple campaign like CRP less than 1, or it is a targeted campaign of educating people regarding metabolic health in any way. अगर हम ना किसी को भी 5 चीजें बोलते हैं करने को, तो वो 5 में से एक करता है और वो एक भी 1 महीने तक करके छोड़ देता है. अगर हम सिर्फ एक हाई रिटर्न बिहेवियर चेंज ले आए, सिर्फ एक हाई रिटर्न बिहेवियर चेंज, और सिर्फ 1 या 2 या 3 सप्लीमेंट्स ऐसे शुरू करें जो हमारी पॉपुलेशन को फोर्टिफाई कर सके, जो कि ऑनगोइंग बेसिस पर लिया जा सकता है. That would go a long way in preparing general population to fight not only what is right now here, but also what is going to come in the future. क्योंकि ये रुकने वाला तो है नहीं. This is just the beginning वो जो हमारे ग्रंथ कहते हैं ना कि ये तो कलयुग की शुरुआत है, but we have to be prepared, educate people, fortify people, build the basic bricks of good metabolic and immune health. The global health burden, as we have said, USA 35%, Latin America 24%, Gulf 37%, South Asia 30%, India 3%. There is increased morbidity, mortality, increased risk of cardiovascular disease and type 2 diabetes, increased risk of cancers, high morbidity with COVID-19. You have to be aware of what is happening around you. Also, हमारे कंट्री में भी कोई बहुत रोजी पिक्चर नहीं है. 3/5 of deaths in India are attributable to non-communicable diseases. Nearly 51% of the population more than 60 years of age has chronic heart disease. About 50% has hypertension, and about 10% of Indians are obese. So ऐसा नहीं है कि इंडिया में भी बहुत अच्छी पिक्चर है, लेकिन इंडिया में ग्लोबल एवरेजेस से काफी बेटर है. अगर हम देखें तो ब्लड ग्लूकोज seems to be the most easily measured metabolic parameter and most predictive of metabolic health. आप कोलेस्ट्रॉल को देखो, कोलेस्ट्रॉल इज नॉट हमेशा से रिवाइज होता चला आया है. दिस इज प्रोपोर्शन ऑफ अचीविंग आइडियल. सो ये दिस हैज बीन नॉट डाइट, physical activity, these have been the ones which have not been addressed enough. Smoking is high on adiposity is high on focus, blood sugar is high on focus, blood pressure is easily measured, is high on focus. तो अगर एक फैमिली फिजिशियन हर 6 महीने में सिर्फ ब्लड ग्लूकोज, ब्लड प्रेशर और वेस्ट टू हिप रेशियो ही सिर्फ बता सके अपने 80% पेशेंट्स को, तो वो CRP less than 1 अचीव हो सकता है. All that we have to do is whatever else we communicate to the patients, at least these 3 things are visible to them. उनको अपना ब्लड प्रेशर दिखाई देता है, उनको अपनी ब्लड ग्लूकोज का रिजल्ट दिखाई देता है, और उनको अपना वेस्ट टू हिप रेशियो, अपना बॉडी इमेज दिखाई देती है. It's easy to educate patients with high return by things which are visible. This is what I was saying, that in US, between 99 to 2018, only 6.8% of adults have optimal cardiometabolic health. And this is across the board. It doesn't matter if you're white or black. It doesn't matter if you have Mexican ethnicity or Asian. It is a very damning statement on the population health. ये उसी पेपर में से ग्राफ है of what is happening with 20 to 30 years old, 35 to 50 years old, 50s to 65, and more than 65. This is overall. But you see, even the 20 to 35, the otherwise professionally active are, these are the highest. These are the people who are going to burden the healthcare in the coming 10, 15, 20 years. So, even though there might be some things that you can't change, like your genetics, there are some things that you can change, like the epigenetics. You can change risk behaviors like smoking, physical inactivity, poor diet quality, overeating, inadequate sleep, you can follow traditional biomarkers. As I said, अगर हम सिर्फ ब्लड शुगर, ब्लड प्रेशर और वेस्ट टू हिप रेशियो बताना शुरू कर दें अपने पेशेंट्स को every 6 months, even that will go a big way. See, what happens is कि जब तक आपके लैंडस्केप में वो चीज दिखाई नहीं देती ना, तब तक आपको वो अर्जेंट और इम्पोर्टेंट नहीं लगती. अगर आप दिखाना शुरू कर दो, it takes only 1 minute, less than that, for you to tell a patient you think is at high risk that he is at high risk, and that the reason you think he's at high risk is this. And if there is only one measure that he can take is to start moving. बस वो हिलना डुलना शुरू कर दे. अगर वो, if he starts moving, his sleep will improve. Hopefully his nutrition will improve, but that can be your second rung. So only if you can introduce physical activity, एक जो मन करता है वो करो, लेकिन हर घंटे में 2 मिनट के लिए खड़े हो जाओ. In COVID-19, the deaths among people with cardiovascular disease have been higher. Deaths in people with, and we know that comorbidities के साथ disease severity is high. तो हमारा policy objective is to target these high risk groups and to see what we can to improve the outcomes in these groups. So there are tailored protocols, there is rationalization of use for acute critical care, there is communication regarding specific COVID-19 risk in these people, and there is non-pharmaceutical intervention. Educate your patients, minimize high-risk behaviors. So what then is that one thing that can be done? Now, this was a very interesting paper which said that metabolic syndrome में हम बहुत सारे parameters को देखते हैं. We look at blood pressure, we look at blood sugar, we look at body mass index, we talk about all those things, but we ignore sleep. And actually, the metabolic syndrome is sort of the end point of circadian syndrome. So it is, they say that if you can repair sleep, you can repair a lot of metabolic dysregulation. So what is the circadian clock and what is the metabolic derangement that you see? We all know that there is the suprachiasmatic body clock, which is situated in the hypothalamic suprachiasmatic nucleus, which controls our sleep-wake cycle and our hormones and metabolic processes. The central clock is synchronized with all of our peripheral clocks, including our peripheral skin cells, heart, liver, adipose tissue, and everything. The main thing is that light is the main regulator of this internal clock. तो जितना हम आर्टिफिशियल लाइट को जितने लंबे ड्यूरेशन के लिए एक्सपोज्ड हैं, उतना हम डिसरेगुलेटेड हैं. Temperature, feeding, fasting are sort of allied ancillary regulators, but light is the main disruptor. So the disruptors of the circadian rhythm are light and constant availability of food and regulated air conditioning. What are these things doing? At a genetic level, they are causing epigenetic DNA methylation, which is causing aging and metabolic dysregulation. So ये criteria जो हैं, they have been harmonized for clinical diagnosis of metabolic syndrome. And you could take a screen grab of this and use this in practice. But I feel that if we have to reach more people, we have to make it simpler. If we have to make a change, we have to make it simpler still. CRP less than 1 is a very good campaign. बट उसके लिए हमारे को करना क्या है, वो एक एक्शन जो हमारे पेशेंट्स कर सके, वो एक सप्लीमेंट जो वो ले सके, वो एक लाइफस्टाइल चेंज जो वो कर सके, और उसको अगले 6 महीने में it has to become a way of life. It has to become a lifestyle. That is the challenge that we have to take on now. So again, a lot of things here, but metabolically healthy obesity. So that is when somebody might be looking fat, but he is not unhealthy, is where the insulin sensitivity is maintained, systemic inflammation is not rising, and there is decreased adiponectin, but there is no cytokine inflammation here. The adipose distribution here is not central. There may be subcutaneous fat. The person may look overall sort of fluffy, but he is not at increased risk of type 2 diabetes or CVD. These are with a stable kind of risk. This is where it is more easily reversible. Now, what is metabolically unhealthy obesity is where there is not only increase in subcutaneous fat, but also central, intra-abdominal, epicardial, hepatic, skeletal muscle and pancreatic fat. The adiponectin is hugely decreased, leptin is increased, resistin is increased, these cytokines are increased. And you don't have to do very much to improve your cardiometabolic or brain health. People say that 4 minutes of exercise is enough. Some say 7 minutes of exercise is enough. But then why exercise? मतलब exercise के बारे में हम सोचते हैं तो लगता है अब हिलना पड़ेगा. Exercise brings about a lot of changes. The acute adaptations in exercise include increase in glucagon and decrease in insulin. So आपकी insulin sensitivity improve होती है. There is increased mobilization of triglycerides and lipolysis. There is improved cardiac output. All these are improving both lipid metabolism and sugar metabolism. But ये सिर्फ acute adaptations ही नहीं हैं. There are some chronic adaptations. There is increased insulin sensitivity, increased gluconeogenesis, increased glucose uptake, increased fat oxidation. So there's a lot of things which are happening, but importantly, the cardiac health is improving, muscle mass is improving, and insulin sensitivity is improving, which means at a whole body level, health is improving. So the physical activity and metabolic health are sort of twins कह लो. Marriage तो नहीं कहूँगी क्योंकि always that partnership is not always very happy, but this partnership is always very happy. So the dance of fitness requires a lot of factors to interplay, और इसमें भी हम IL-6, TNF alpha कहाँ गया, मैंने देखा था, TGF beta. So इसमें भी we are seeing the same cellular mechanisms. So when we exercise, the paracrine influence of myokines is on skeletal muscle mass, glucose metabolism, and results in secretion of IL-6, IL-15, apelin, muscarinin, and brain-derived neurotrophic factor. The triggers are the turnover of ATP. तो जब तक हम body में एनर्जी यूटिलाइजेशन के लिए ट्रिगर नहीं क्रिएट करेंगे, तब तक ग्लाइकोजन नहीं डिप्लीट होगा और तब तक बेनिफिशियल इफेक्ट्स ऑफ एक्सरसाइज नहीं फील होंगे. The endocrine influence on metabolism is there on liver function via myonectin and IL-6, pancreas via IL-6, microvasculature via VEGF and nitric oxide, and adipose tissue via IL-6, EGF2 and GDF15. So all these are, creating that health of improved insulin sensitivity, lowered blood pressure, improved glucose and fat metabolism, and improved health. While this might look we are going too much into the detail, lekin knowing what really happens probably will make us more motivated to do it. So humans are meant to move. In the prehistoric days, जब caveman होता था तो उसको एक दिन में 10-10, 20-20 किलोमीटर चलना पड़ता था just to gather food for his family. It is the muscle tissue is the largest metabolic tissue of the body. आजकल हम क्या करते हैं, वो जो हम पहले 8 से 10 घंटे चलते थे foraging for food, आज हम 8 से 10 घंटे बैठते हैं consuming the food. This is the critical site for glucose disposal. Muscle glycogen and circulating glucose are used up in exercise. Muscle contraction activates both oxidative and non-oxidative glucose disposal via both insulin dependent and insulin independent mechanisms. तो रेगुलर एक्सरसाइज से क्या होता है, स्केलेटल मसल बढ़ता है, उसकी ऑक्सीडेटिव कैपेसिटी बढ़ती है, माइटोकॉन्ड्रियल बायोजेनेसिस. दिस इज द बेस्ट एंटी एजिंग मेडिसिन दैट यू हैव, मूविंग. And mitochondrial quality control, both the fission, fusion and mitophagy are improved by regular exercise. Endurance training se kya hota hai? Oxidation of. So what is endurance training? Endurance training is when you can sustain some activity for a longish period of time. When this happens, then fatty acids get oxidized, lipid metabolism is improved. There is increased demand, which is driven by the myocyte fatty acid transport and oxidation in the mitochondria. So mitochondrial health is improved. There is reduced lipid intermediates, which are the ones which cause oxidative damage. There is a triggered increase in hepatic glucose output and decreased non-alcoholic fatty liver disease. Liver में क्या होता है? The dance of fitness is not limited to the muscle, which is the main actor in the drama. There is increased release of glucose from the liver to maintain circulating glucose because demand बढ़ गई है. There is increased hepatic glycogen mobilization, increased hepatic gluconeogenesis, which is fueled by increased uptake of lactate, pyruvate, and glycerol. So the oxidative stress in circulation is decreased. Driven by exercise-induced rise in glucagon, there is a drop in insulin. The exercise-induced decrease in insulin also sensitizes the liver to glucagon. Exercise without weight loss also increases ability of insulin to suppress hepatic glucogenesis. तो जरूरी नहीं है कि आपको weighing scale पर दिखाई दे, लेकिन अगर आप कंसिस्टेंटली फिजिकल एक्टिविटी कर रहे हैं, उससे भी आपकी इंसुलिन सेंसिटिविटी और मेटाबॉलिक हेल्थ इंप्रूव हो रही है. Exercise also increases lipolysis, decreases lipogenesis, and contributes to prevention of non-alcoholic fatty liver disease. Now, IL-6 increases the hepatic fat oxidation. Myonectin improves the liver fatty acid uptake. So circulating lipid also reduce in the body. Adipose tissue में क्या होता है? Is this the final rung in the ladder? Of course हमारे को तो दिखना ये चाहिए ना कि बंदे की metabolic health improve हो रही है और fat कम हो रही है. So the whole body fat oxidation is increased with sustained exercise. Exercise increases catecholamines so that there is more lipolysis. There is a triggered atrial natriuretic peptide, which is also lipolytic, and exercise decreases insulin, which is lipogenic. Exercise, even of low intensity, improves sensitivity of adipose tissue to both catecholamines and insulin. There is enhanced mitochondrial biogenesis, improved mitochondrial function, improved blood flow, and decreased circulating glucose because increased uptake in metabolically active tissue. There is a modest loss in adiposity, even in the absence of weight loss, if there is sustained exercise, क्योंकि muscle की lipoprotein lipase is increased. There is a reduction in inflammatory markers of adipose tissue, improved insulin sensitivity, increased lipolysis driven by IL-6. In fact, this is such an important topic that there is a call for a new subspecialty training track in internal medicine. What they're saying is that we should call it cardiometabolic medicine with a proposed training plan of 3 years. So it should be a super specialization only focused on cardiometabolic medicine. It should have an endocrinology component, a cardiology component, and an internal medicine component. It should merge all these into a preventive health, but practically applicable, not public health, but individualized medicine, where you can make a dent in the public health problems through individualized health plans. Now, if we look at what is happening to calorie consumption in the world, आप ये देख रहे हो, US is this white line. Calorie consumption in US has increased from 2,800 to 4,000. And in Asia, it has increased from near 1,900 to 2,800, 2,700. Look at Africa. Largely stable. बहुत ज़्यादा नहीं बढ़ा है. Latin America बहुत बढ़ा है. It's European Union significantly बढ़ा. उनका तो baseline ही बढ़ा था. They were consuming 3,000, now they're consuming 3,500. But what this is a story of poor health among abundance. It's a story of scarcity of health in abundance of all other factors. I don't have to go too much into the detail for this because we all know what fat does, but basically fat drives inflammation, and visceral adiposity increases chronic inflammation, hormonal activation, and insulin resistance, resulting in both type 2 diabetes and cardiovascular disease and metabolic dysregulation. अगर आप बहुत लंबा चौड़ा कोई फिटनेस प्लान नहीं कर सकते, तो आप सिर्फ 7 मिनट का सर्किट कर लो, आप सिर्फ 4 मिनट का सर्किट कर लो. So this is a time saver, high intensity fitness circuit in 5 minutes or 4 minutes, which says that you can do a jumping jack, जो हम सब बचपन से ही करते हैं, और अगर आप जंप नहीं कर सकते तो आप सिर्फ अपने हाथों से ही कर लो. वॉल सेट which improves leg health. पुश अप अगर आप पूरा नहीं कर सकते तो आधा कर लो, and a crunch. अगर सिर्फ ये 4 exercises कर सकते हो तो ये 4 कर लो. I had given you the nitric oxide dump. If that's just 4 minutes, that can be done once in a day. something simple. And as a dedication, I would say that every day we should be asking ourselves, what did you do today to create a better world? Did you change the life of one person for the better? अगर हम रोज रात को ये एक क्वेश्चन अगले 6 महीने तक पॉजिटिवली आंसर कर सकें, तो in all probability we will have moved to a better world with less public health problems.
Brilliantly concluded, Dr. Nidhi. Thank you so much for taking our time and doing this very simple, albeit very, the pertinent topic today. I think you sort of talked about a lot of different aspects of being a good doctor. The floor is now open for questions and discussions. If anyone would like to talk about something, now would be the time. There are a few questions in the chat box. What are the factors that decrease our immunity? By Dr. Sanjeev Agarwal. And should obesity be noted in population census to be done? Obesity could be due to disease or overeating.
I'm sorry, Meenakshi. I know, I'm going to take it from the very basics here. आग मैंने माचिस से लगाई के लाइटर से लगाई के दो पत्थर घिस के लगाई, आग तो आग ही रहेगी. Now, whatever the cause of obesity, once you document it, the method to deal with that fire is to douse it. And yes, the other factors which contributed to it will be important to deal with, but the water is an improved lifestyle which has those 3 pillars: good sleep, good nutrition, and physical activity. अगर हम इन सब चीजों को और सिंप्लीफाई करना चाहें तो मतलब sleep, I feel, is the most important casualty in the process. However, sleep is not something that people are willing to or able to change very quickly. Physical activity के लिए अगर हम जरा सा थोड़ा सा भी कुछ करना शुरू कर दें ना तो 0 के ऊपर it is 100% gain. Now I'll leave it to you, Meenakshi.
No, I think I wasn't even attempting to answer because the question was directed at one of your slides, I think. But yeah, we've been every single thing that you've been talking about in today's discussion, lack of it, activity, and then, lack of good quality sleep. These things definitely contribute towards our immunity in the larger picture, if not, in the microcosmic picture. So yes, about that, and obesity should be should we be putting it in the population census? I think you've tackled that well. So
I have a question.
Yes, please.
How can we reduce CRP? There, sir used to say about some trikatu churna. Should we use that?
So trikatu was for your liver health. What we had. I don't know, Dr. Nidhi, if you know about it, but one of the Navratras, what Sir did was he asked all the health educators, a big, maybe around 30, 40, or it was the sample size was around 70. So we asked them to get their CRP done before the Navratras, and maybe 1 day or 2 days before the Navratras. And, for 7 days, all these people, they were anyway going to be fasting. They were only taking the sattvic food. And after 7 days, we got their 7 or 8 days, whenever their fast ended, we got their CRP done again. There was a significant decrease in their CRP. So fasting, whenever in Navratras, probably they were doing, the puja or whatever it is. So a little bit of meditation, all these things contributed towards lower CRP. So this was, this is where we started off with the CRP less than 1. And Dr. Kiran, to answer your question, whether you want to take Trigger 2 or not. So, sir was talking about how metabolic syndrome also has a higher CRP and it is associated with liver health. Trigger 2 is given for liver health. So, if your liver parameters are not the best, or if you think that they have been increasing, even if they are normal, but they have been they are on the increasing trend, then you can probably take Trigger 2. But then again, I would suggest that you speak to an Ayurvedic physician because I really don't know about Trigger 2 a lot. So, sir had this in that CRP less than 1 campaign. There was this entire protocol that was to be followed by people, and over 3 months, again, we saw a decrease in CRP. So, of course, some of them were also given colchicine, but
If we have to take colchicine for how long? Because of CRP, I think it's because of comorbidities.
so then if your CRP is because of the comorbidities, then the comorbidities also should be tackled. You need to it's not वो तो खाली बस वो आग बुझाने वाली बात है, और लेकिन अगर आग का source जो है that is still very active, then it's going to keep coming back. So it's not, colchicine is just basically something that just suppresses it right away. But then if the root cause is not being tackled, then that will keep coming back. So we need to find the root cause. So has done so many videos on how to, why your CRP could be raised. So even arthritis and simple things like that, they also cause, it's arthritis is of course just the inflammation of the joints and nothing else. So अगर inflammation है, तो CRP less than 1 तो नहीं होगा.
Okay, thanks.
Yeah.
Madam,
so, sir,
we are seeing
Yes.
seeing most of the childhood obesity patient. What is the advice to the parents?
you are mute, Dr. Nandini.
The advice to the parents. So what I do is I tell the parents के आप बच्चे को अगर सुबह स्कूल के लिए 6:30 बजे उठाते हो तो 6:25 पर उठा दो, और जब उठाते हो तो खड़ा कर दो और उससे 50 जंपिंग जैक करा लो. Kids have a lot of energy, and उनकी पूरी दिन की एक्सरसाइज रिक्वायरमेंट उसी से पूरी हो जाएगी. दैट इज टू द पेरेंट्स. प्लस I have experienced with a lot of people कि kitchen seems to be the least important room of the household now. Zomato है, Swiggy है, रात का 1 बजा है या दिन के 2 बजे हैं, कोई मतलब ही नहीं है. मतलब आपको जब चाहिए तो dial and get your food. That needs to be controlled. तो अगर 2 ही चीजें कंट्रोल करनी है तो एक तो फिजिकल एक्टिविटी इंप्रूव कर दो, और दूसरा हफ्ता भर घर का खाना खाएगा तो वीकेंड पर इसको इसकी पसंद का खाना मिल जाएगा. And that is enough for tackling this at a childhood level. But that's the way I do it, and you could have your own methods of doing it.
So if Dr. Nidhi allows me, there was a sort of a poster from our CRP less than 1 campaign that sir had. So if it's okay with you, I'd like to share that.
Absolutely.
So of course, this was when we were enrolling these patients for this campaign, and this is what sir's take was. This is the protocol that we had given. So just because Dr. Kiran had talked about Trigger 2, I thought I'll just share this. So he said that there should be, so sir was a very firm believer. He already had Crohn's. So he was, he used to say very vehemently that wheat is an inflammatory product and wheat should be avoided. So that was there. So no wheat for 1 month, no wheat and related products. So that means that there would be no suji, there would be no maida, there would be no no dalia, wheat dalia, nothing. So wheat completely to be eliminated. 20 minutes of walk daily. So this is just so simple. And Dr. Nidhi has been talking this entire episode about that one thing that you would like to change. And if someone asks me, I would say 21 minutes of walk every single day, and that it just changes your mindset. That the moment you think that yes, I'm doing this for my better health, the whole day, the 21 minutes, and if you are sort of not distracted in those 21 minutes, you're thinking about your health and your better health. So I think that carries forward for the rest of the day. And Dr. Nidhi also mentioned that exercise करने में भी आपको you think that अब हिलना पड़ेगा. So that is एक अगर हम हमारे जब हम when we wake up in the morning, when we are fresh, if we just do our exercise at that point of time, then I think that it really does carry forward the rest of the day. There are a lot of times when I do, like you don't exercise in the morning and you think you'll do it in the evening. That evening never happens. It doesn't happen. So जब आप fresh हो और बहुत ज़्यादा आपके दिमाग active नहीं है, बहुत ज़्यादा stimuli नहीं है, if you have just started off with your activities at that point, I think that really helps. Sir had mentioned about Kalmeg. He found this to be a very potent anti-inflammatory, sort of herb, and we did see results with this. So I would like to tell that Kalmeg khali leke, and there was no colchicine in a lot of patients, and even then we saw that there was a significant decrease as compared to people who were not taking Kalmeg. So that was about the Kalmeg. He was again very particular about this ghee, butter, and makhan. So ghee, butter and oil, ghee, tel or makhan, one person is supposed to consume less than half kilo in 1 month. And ये मतलब सब कुछ मिला के आप जितने भी ये fats हैं, this has to be less than half kilo. Trichotillue he had talked about because of liver health and because of its role in metabolic syndrome. Every other medicine and diet has to be continued. There is no restriction really. And mutton, yellow of an egg cannot be taken. This is what Sir had said. And we had carried this on for 3 months. Unfortunately, data was not, we were not able to publish this, but we do have the raw data, and that was quite convincing. So this was the protocol that we had, sort of started off at that time. Dr. Rora, you wanted to say something? All right.
Sorry, it's okay.
No, it's okay.
Dr. Sanjeev is saying that RO maybe, I don't know much about RO and how it affects health, but if there is something that he knows and it's a good enough reason to address that. We will all know कि हमारे को क्या चीज अपील कर रही है. अगर हम सब लोग अपने पैशन के हिसाब से एक चीज भी उठा लें ना, we will make some improvement in the health of people that we touch. I mean, for some people it might be better sleep, for some people it might be better exercise, for some people it might be better water, so for some people it might be meditation. But if you are able to do that according to your own comfort, what is it that you feel most passionately will make a change in the patient's health? If you just start that one activity and monitor it over the next 6 months, then it'll be a good thing to do.
Yeah, I think, that one thing would differ from person to person, whether it is, I honestly believe that one positive change, whether it is meditation, whether it is just walking for 20 minutes, whether it is giving up weight, whether it is, something that can be consistent. I think
Yes.
The only thing, that is rewarded in today's time is consistency, and anything that consistently we can do over time would be contributing to our better health. So, I think no more questions, and we've said enough today.
A lot of food for thought.
Yes, a lot of food and a lot of epiphanies and a lot of philosophical talk as well. So I hope that we Dr. Nidhi was able to change at least one person who's viewing. As she said, at least 8% को अगर आप change करें for the better, that would go a long way. So thank you, Dr. Nidhi, for doing this with us. A big thank you to all of you for joining in and keeping this show alive. We'll be back again next week. Until then, goodbye.
Thank you.